We want to talk about health packages to each and every one of you out there, and especially for me, to be very honest. And more info about this, I want to tell you is that...
Loving the admission of certainty there on air today.
Pew, pew. There you go. On the foot. But
Definitely.
of course, this is an initiative by the government through the Ministry of Finance to provide healthcare to the B40 community. And more about this is, of course, the recipients of Sumbangan Tunai Rahmah, which is STR, within the B40 community will be able to receive this treatment at private medical clinic of GP. But of course, they have to be registered under the Madani medical scheme. Now, some stats, of course, up to 700,000 households can get the acute cases outpatient treatment required at the GP.
Exactly. And to know more and to really understand what it is that Brandon just talked about, we actually have a very special guest together with us here. He's going to be sharing with us on this bit. We have together with us Muhammad FADZREL Abu Bakar, the head of section benefit package and payment mechanism, Protect Health Corporation. Good morning, FADZREL.
Morning, Mior. Morning, Brandon. How are you guys?
We're good. One thing I do want to say on camera right now, because when Atomic Kitten was actually playing, we were singing together with you as well, FADZREL. And
I grew up with them.
Oh, there you go. There you go. Definitely a man of our generation over here. So let's kick things off, FADZREL, because this is actually a very interesting topic that apparently not a lot of Malaysians know about this. And what we would like to know, first of all, is what actually is the scheme Perubatan Madani that is out there right now, assisting the folks of Malaysia?
Good. Again, thank you so much, Brandon and Mior, for having me here today. So, like you said, potentially a lot of Malaysians might not be aware of the existence of the scheme Perubatan Madani or the Madani medical scheme, because we just launched it not even like a month ago, 15th of June, 2023. So basically what this scheme does is it covers acute primary care services. That includes treatment, consultation, medication and procedure for the disenfranchised population, or disenfranchised population better known as B40 for Malaysians. And who are eligible for this scheme Perubatan Madani is for those who are the Rahmah cash contribution recipients or Sumbangan Tunai Rahmah STR recipients, where like what Brandon said or mentioned in the beginning of the show, they can go to any empaneled or registered GP or private clinics, private practitioners in the selected districts to get the access to free treatment like I mentioned prior. So that's basically the gist of what Madani medical scheme is all about.
So they don't have to go to a clinic kesihatan or any government facilities. They can even approach a private clinic to actually, receive, or should I say that, to get all of these privileges.
Correct. Nice. You are absolutely correct, Mio. Yeah.
But okay, briefly tell us, in terms of like private medical facilities, as compared to the traditional like clinic kesihatan and all that, would you kindly tell us, very briefly, the differences involved?
All right. So, in terms of the differences, we know that our healthcare facility, the public healthcare facility, is experiencing congestion. We have a lot of people, and thus waiting time resulted into waiting time, quite a long time for us to get service. The difference is that with scheme Perubatan Madani, why we rechannel the acute primary care services to the GP is because one, waiting time is shorter. Two is the abundance of GP clinics residing in the cities, right? They are mushrooming every day in comparison to the public healthcare facilities that we have. So with these two distinctive advantage, I would say, which is why we want to collaborate, the Ministry of Health wanted to collaborate with the GP in order for us to provide the service through the scheme.
Oh, fantastic.
Yeah, that's actually a great initiative that's being done, because again, as much as we want to, we want to believe, which is kind of true, even like, healthcare is for everyone, but there are some people, unfortunately, who are still bounded by the affordability of it and the access of it, because like if you have to only go to a government facility every single time, then it somehow deters people because of the longer waiting time and the uncertainty of that as well. We've mentioned, or should I say Brandon has actually, he did a lot of homework on this one. So he actually mentioned the scheme that is being introduced right now is targeted for the B40. Can you elaborate more on that? And how would they know that they are really eligible for this?
Yeah. Again, thank you, Brendan. I guess on Muir as well. I guess you guys did a tremendous job for researching about the scheme. So basically, the eligible beneficiaries they only have to fulfill 2 criteria.
Okay.
One, they have to be the recipient of Rahmah cash contribution or Sumbangan Tunai Rahmah. And 2, they only have the only thing that they have to bring to the GP in order for them to access the service is bring their identification card. And that's it. With these 2, they could get free acute primary care services within the 10 selected districts that we have announced for free, like I said.
Right.
Yeah.
And those 10 districts are?
The 10 districts, Selangor have 4 districts altogether. We have Hulu Langat, Klang, Gombak and Petaling.
Nice.
Right.
Kuala Lumpur, the overall Kuala Lumpur itself.
Yep.
And then we have Southern State, Johor, represented by Johor Bahru, of course. We have Northern State, represented by Pulau Pinang. Penang, we have in Timor Laut. And then, of course, we have our dear, we have Central, Perak, Kinta. And of course, we're not forgetting about Sabah and Sarawak. So Sabah, we have Kota Kinabalu, and Sarawak, we have Kuching.
That's right. So obviously, 10 districts that you can see right now on your screens. For more info, you can of course visit protecthealth.com to get further information and to get more information about the eligibility and so on and so forth. Before we move on to the objective and stuff, right? Let's talk about the aid that they will receive from 75 ringgit onwards. Is that right?
Yes. So we categorize the recipients. Like I said, the overall Sumbangan Tunai Rahmah recipients could get the free services. However, to make things easier, we categorize the recipients. So the first recipients, or the first group of recipients, the first category is a family household, multi-member household, where they will receive 250 ringgit for the course of 6 months. And then we have the next category, which is elderly without spouse, right? Or single citizens without spouse, where they will receive 125 ringgit for the period of 6 months until the end of this year. And then, of course, like myself, singles, they have 75 ringgit until the end of this year. So these are the benefit limit, we call it, that they could use and utilize within the 6 months for Scheme Perubatan Madani in order to get the free acute primary care services.
Awesome.
I just love the fact that he slid it in there, like, okay, like myself, single, please do not contact Protect Health should you want to know about his availability. In regards to work, then it's fine, it's okay. But yeah, I mean, like that's really awesome. And one thing that I've actually spoken to one of your colleagues about this as well. Like you said, last month, you actually came down here at Angkasa Puri, to be exact, to promote it, to do some brand awareness, to tell the people out there, to make sure whether or not they know what is going on. And now you have participations with the private sectors as well. How has that progress been? Again, I mean, like, has the the collaboration, or should I say, the work, the togetherness with the private facilities has been good and is growing, I believe?
Yes, and we're very fortunate, Mior, actually. Since the Scheme Perubatan Madani started, 15th of June, not even, I think a month and a half ago, we have more than nearly 1,000 GP that have actually empaneled and ready to serve the eligible beneficiaries throughout these 10 districts. So these general practitioners are ready not only to provide consultation and medication, but with this scheme, we also cover basic procedure like suturing, wound care and things like that. And of course, point of care testing, where we have this swab test, dengue test and things like that, right? So in order to save time in terms of getting treatment for these beneficiaries.
So there are many benefits out there as well. Though we spoke about waiting time being shortened, and then we spoke about how 10 districts are in participation of this wonderful strategy, or I would say aid, right? So are there any other benefits for the people out there who are watching at home, who probably want to check this out?
Yeah, that's a very great question, actually. So this Madani medical scheme is actually, one of the benefits why we're having a partnership with our GP partners is because it gives the flexibility to B40. Many doesn't realize this, Mio and Brandon. I mean, granted that maybe you guys are both T20.
I am.
I mean. But B40 often hampered
Yes.
or
Yep.
burdened by catastrophic health expenditure,
Yeah.
whereby when it comes to seeking healthcare services, often are not their main priority,
Okay.
right? So if I were to juggle, if I'm a B40, I were to juggle between having a daily payment and having to take care of my fever, I'll choose my daily payment because that brings,
Yeah.
you know,
Truth be
rise to
told.
the
Yeah.
table, right?
Truth be
Yeah,
told.
So
exactly.
with this Madani medical scheme, we hope to assist a little bit to reduce the financial burden in order for them to seek proper medical care. And given like what Brandon is asking, the advantage is it gives flexibility for them to get the service. Like
Yeah.
we know public healthcare services only up until like 5, or now we have, in some areas we have extended hours for clinic up until 9 p.m. But the GP can provide, and sometimes they are providing 24-hour service, right?
Sure.
So
Yeah.
that's some of, if
Yeah.
adding to the advantages for this scheme. Lah.
Awesome.
Yeah, because it does. I mean, it makes total sense. The fact that this collaboration with the private GPs and whatnot, they are literally everywhere. And
Correct.
like you have mentioned as well, it is like mushrooms right now. A lot of practice right now are opening up literally everywhere in new housing development areas, in corners of the world that we may not even know of. So
Yeah,
this
that's
is
right.
definitely is something that a lot of people can take advantage of, especially when you're in that pinch, when you're in that situation in need of healthcare. Because healthcare, again, as mentioned, it is for everyone. It is for all Malaysians, and
That's right.
no one should be turned
out,
away
yeah.
because of the line is too long, because of the opening hours, or because they can't afford it. Because
Yeah.
again, who's going to move Malaysia if not us, ourselves?
Correct.
Speaking about the treatment as well, so maybe you can also elaborate to us, what are the kinds of acute primary care services that is inclusive within this scheme?
All right.
FADZREL?
So a lot of people might wonder what's acute primary
What is
care,
acute?
right?
Yeah.
So acute primary care is often associated or defined as sudden onset of pain, and the pain doesn't last longer than potentially 7 to 30 days, and oftentimes, not all, but oftentimes, these acute primary care services are treated with non-steroidal anti-inflammatory drugs, or NSAIDs, right? So with this in mind, so sudden onset of pain and things like that. So just giving examples, some of the acute primary care conditions that could be treated under the scheme is fever, we have flu, coughing, and even ankle sprain, right, where it happens suddenly, right? So what we always focus on for scheme Perubatan Madani in what is not covered, because it's easier. The list is shorter. If it doesn't fall into what's not covered, go and seek treatment. Like health screening, we're not covering it. Immunization, routine immunization, family planning, NCD treatment, routine NCD treatment, rehabilitation service, and of course, request for medication and supplementation without consulting with doctor, right? So these are not covered under the scheme. So if it doesn't fall under what's not covered, go ahead and go to the GP and try to seek the medical treatment.
I think this is literally one of the best steps moving forward,
Yeah.
because back to basics, you
Yeah.
need to identify step one before you actually identify the remaining other steps, and hopefully there's only just one step. But of course, let's talk about how when they receive treatment, and if they have to further their treatment, will all these GP provide them with referral letter to the public healthcare facilities or any of that sorts? Could you please elaborate?
Yeah. So with the scheme Perubatan Madani, we always try to emphasize that GP could have 3 avenues or 3 channels of disposition, patient disposition, right? So the first is, for basic primary acute URTI, for example, coughing and flu, you can treat and discharge, meaning the patient can go home after that. Yeah. The second is, if the GP could stabilize the patient, let's say, for example, if it's code blue, patient fainted in front of the clinic, or like minor accident and things like that, stabilize the patient and then can refer to emergency department for further treatment. And the last but not least, of course, to give the treatment maybe for like 3-5 days just to subside the condition, and if the condition potentially, exacerbate, worsen, they can, of course, go to our healthcare facility, public healthcare facility, or the specialist clinic. So these are the patient disposition that the GP could provide to the patient. Like I said, acute primary care, sometimes it's sudden onset, right?
Yeah.
So GP could provide this treatment needed while reducing the pain and the discomfort by these patients and then dispose them to better facilities.
Very done perfectly, right? I mean, the channeling and stuff.
No,
like that.
it is how it's supposed to be.
That's the
you know,
word for
being
it.
methodical about it, being process oriented about it. Really, you know, it makes people. I mean, it makes people so much easier to access all of this, as people should. Now, we've understand already what is the scheme Perubatan Madani and what it's how it is beneficial and who is it for. Now tell us, how can one get access, or how can one actually obtain this scheme? How do one go about it?
Right. I'll try to answer that in two situations in order to attract more people to use it.
Sure.
Right.
All right.
One, we crafted the package to be very simple in a sense that you only have to bring your IC. Identification card. Just check your eligibility, and of course you can go to either our website www.protecthealth.com.my, or even in My Sejahtera now you can check your eligibility using the IC numbers. Yes, interesting, right? Very, very cool, right? So with these easy steps, you can know your eligibility, right? However, I also would like to add to my second point, whereby I said the scheme is eligible in the 10 selected districts, granted that it's in pilot phase until the end of this year, right? However, for those who are Sumbangan Tunai Rahmah recipients who reside in out of this districts, the 10 districts, but rather, like for example, for any business that they are suddenly experiencing acute primary ailments and they happen to be in the 10 districts, can they receive the scheme Perubatan Madani? Of course they can. So for me, like I reside in Port Dickson, but I work in Petaling, for example, right? And I am a Sumbangan Tunai Rahmah recipient, and during work, I feel feverish and things like that. Can I go to empaneled or registered GP in Petaling to get access to the scheme Perubatan Madani if I'm eligible? Yes, you can.
They won't look at your address on your IC?
No.
That's great.
Wow.
Talking about these 10 districts, very briefly, because we have to go, unfortunately, we are running out of time. Will these districts be expanded in the future?
Hopefully, we're waiting for further instructions from the Minister of Health. And if anything, I'll come back to Fresh Brew on a lovely Sunday morning to talk about it then.
Fantastic.
Lovely, lovely. It has been so informative. I'm totally gobsmacked by this, because again, to have all these kind of things at our doorstep, it's really an eye-opener, and hopefully you guys do take advantage of it. Again, thank you so much to our lovely guest here, Muhammad FADZREL Abu Bakar, Head of Section Benefit Package and Provider/Payment Mechanism, Protect Health Corporation, for coming down together with us.
Thank you so much for being here.